with a number of different units. But what I'm here to talk about is this little old blue box called Community Health. We are your healthcare partner, local. We have a number of facilities, and it's intentional about avoiding you all from having to drive, the citizens of Northern Virginia, to drive to Charlottesville, or maybe it's even worse, drive to DC on 66 in rush hour when you're having a heart attack to try to get treatment. Um, this slide gives you a visual of what our service area looks like. So that orange part represents about 1.25 million people. And the tertiary area expands beyond that orange area. These are the three hospitals or medical centers. To the upper left, Culpeper. Anybody know Culpeper? Y'all know? Okay. Upper right, right down the street, Haymarket. And then of the three, the largest, Prince William. And nearly 50 separate medical group and outpatient locations. And by the numbers, I'm not going to read this, but I would love to email this to you so you can share it, folks can go through it. 164,000 individuals served in 2024. This is a growing endeavor. UVA Community Health is a fairly new construct, and John can tell you all about it. Formally birthed in 2021, but year over year, just in the last year, we've had about a 40% increase in usership. And then planes, trains, automobiles, awards, recognitions, and accreditations. One of our Board of Trustees members said that we need to put all of the great stuff on some billboard on the highway to demonstrate and show this is a really recognized system. And I'm talking about community health. Your three medical centers right here. So Joint Commission, America's Best, Baby Friendly USA, on and on and on. And then one of our big, what'd you say?
The police officer.
You know him. TJ,
Starting connections.
what do you know? Yes, and I didn't know that. So that works out beautifully that this slide is a. Is that right? I haven't met Chris though.
His wife has.
Oh, well, I got to make a point to figure out how to get in touch with Chris. So y'all let me know how to get in touch with Chris. But at any rate, we want all Virginians to be healthy. So why do we do these hundreds and hundreds of events? Why do we offer screenings? Why do we promote health through greater awareness? There's data that shows when we do this, we become more healthy. And then this little thing called the Community Health Foundation. I'm excited about it. I work with corporations, foundations, individuals, this cohort called Grateful Patients to advance what? Transforming health through innovations. And I'm going to show you through some pictures of why I do this. So anybody know that Jenna on the far left? That's Al Stearns. Far right is the CEO, Eric Shannon. In the middle is Dr. Agarwal. Heritage Charity Classic is a great partner. That machine, that device there is called a linear accelerator. And that is one of the newest advances in cancer treatment because it offers more precise, faster treatments, and it's at Gainesville. This machine is a cardiac catheterization lab. We just secured that in the last year, and I'm going to show you a gentleman whose life was saved through this innovation. By the way, that last device was 4 million. I don't really know this one. I think that was 2 million. This is an image of Subaru. Subaru partners with us because we do a lot of engagement around cancer treatment. And these kits are some of the kits that are provided to our patients. And then this is one of the most exciting things called Pamper Me Pink. If you are uninsured or underinsured, you can still get a mammogram. and avoid the challenges. And this is an initiative that's been going on for a while. Heard a statistic today. In this community, Prince William, Manassas, Haymarket, 1 in 4 expectant mothers do not get prenatal care. 1 in 4. We have to do something about that. And then we have this great partnership with Hilton Family Foundation. And then this gentleman here on the right, Tom, he gave us permission, so that's why I can tell you that unit, that cardiac catheterization unit, saved his life. His wife got him to the hospital. We use this device. It runs. I'm not going to try to explain it because I'm not a physician. You saw me going like, eh. And then this family to the left, both of their babies were born at Prince William. Both were born with significant neonatal issues and had to remain in the hospital. And they say for multiple weeks, best care we could have hoped for. And that's it. So I blew through that. See, did I sound like I was on a roller coaster? But yeah, thank you. I'm so sorry. Yes.
Hey, I lived for 30 years in Northern California, and I was on the foundation board for our major hospital there, and we were the largest one north of San Francisco to the road. And we have some really wonderful stories at the foundation when a doctor would come in and say, we need such and such, and then we go out, the foundation goes out and raises the money to buy these catheterization things and all that. And
I'm glad you know. I got to get your card and give you mine.
many years on the foundation.
Would love to talk to you, seriously.
Service, that's what Rotary does. One of the things that we did with the hospital was dental kits for the underserved kids, and we partnered with the hospital on that. So I wondered if would that be an opportunity of partnership?
You better believe it. So Delta Dental Foundation is an organization we already work with. People forget that oral care is healthcare. And what I'm working on now is a strategy, a pilot demonstration project through our cancer care center for cancer patients and their oral care treatment, because the treatments, they, cause all kinds of issues. And we need to figure out how the patients who get chemo and radiation can have a better experience with their oral health care. But yes, so I got plenty of cards, John knows. And I'm gonna see you next Tuesday, right?
Yes.
Yes.
He gets around.
He gets around. He and Erna. I can't wait to see him.
In Mary Kay, in other parts of the country, like my family, they do cancer cake kits with Mary Kay products, and so that's them wanted to start locally and have never quite gotten it off the ground. So,
I would love to chat. I got cards.
Yeah.
All right, and you're Seema. Seema, you should have seen me. It was the grace of God. So I'm sitting in the meeting. I'm standing beside. Did anybody know Cindy Kaser? Does that okay? So I'm. She did.
didn't know either.
She did. So I'm on the phone and I said, today you can get spam, you can get spoofed. So I said, her email is See Me Vision. And she says, mm-mm. So I called her. I said, so I'm standing here with Cindy Kaser and she wants to know who you are. And she says, well, I don't know who she is. It was.
Because she's Northern District isn't going to be here and would know who I am. So I'm like, which Cindy?
It was the craziest thing, but God is amazing. God is good. John, what do you want to add to what I've shared?
Well,
Well, the foundation and the organization in our health system is by far the best I've ever encountered. I served as a trustee for 15 years on the health system board. And it was the best 15 years I've served. I was chair of the quality committee too. So that's why some of those awards are up there. We got started way back, rapid response teams and things like that. So the health system here in Prince William County is great.
But we need more. That's why I don't want to rest on my laurels by saying that we have it all. People, this is what people say. UVA's got more money than God. What do y'all need money for? And what people don't understand, those two pieces of equipment, one was 2.5 million, one is 4 million. You still have overhead and operating expenses. Getting primary care physicians is a huge issue. We're trying to find incentive money because when's the last time you got a doctor's appointment that was less than 2 weeks or it's hard. So it requires investment. And the thing I'm going to close with is it all stays local. Thank you. I appreciate you.
We have a gift for you, just a mug to remember being a Rotarian. Right, you were